So we'll move on to our canine vaccine research that was done last summer of last year at two of our partner shelters in our Purdue Maddie Shelter Medicine program, PAWS Chicago and the Humane Society of Indianapolis. So we aimed to determine the parvovirus and distemper virus antibody test status of dogs that had no known history of vaccination at the time of shelter admission. And we wanted to document that antibody response over a 2-week period by testing each week. We used 2 study locations, as I said, PAWS Chicago and Humane Society of Indianapolis. Now, the setup for the study was slightly different at each of the 2 locations. PAWS Chicago is one of the largest adoption guarantee shelters in the Midwest. Some of you may have visited it, and it accepts most of its incoming dogs from the local municipal shelter, which is a mile down the road, Chicago Animal Care and Control. So we were able to have access to the dogs as they were coming into PAWS Chicago, and we were particularly interested in dogs that were 4 to 24 months of age. So they were old enough that maternal immunity wasn't going to be a confounder in our study because we were studying antibody protection levels. And also they were still young enough that they were young dogs that were our at-risk population. So these dogs originally came into Chicago Animal Care and Control, where they should have received a modified live vaccine for distemper and parvovirus on intake. Then after a period of 5 days, then we were able to bring them into PAWS Chicago, and we started the study then. So that was the setup for PAWS Chicago. For the Humane Society of Indianapolis, it was slightly different. So Humane Society of Indianapolis is a limited admission shelter. They do have quite a few walk-up stray animals, as well as animals that they're getting from the local animal care and control and from other shelters that are transfers. So the enrolment criteria for the dogs at Humane Society of Indianapolis was any dog that when the person brought it in, that dog had no known history of vaccination. So there were quite a few stray dogs in there. There certainly weren't transfers from other shelters. And in order to get the numbers that we needed, we just opened it up to any dogs that were over the age of 4 months of age. So what we did was collect sera from these dogs at 3 time points. So firstly, on the day of enrolment, before they were vaccinated at either PAWS Chicago or at the Humane Society of Indianapolis. And then we got results from those dogs using a point-of-care test, which was a Synbiotics TiterCHEK parvo and distemper test. And any dogs that were not protected on the day of enrolment before they were vaccinated, then we followed up with those dogs at day 6 to 8. We again repeated that TiterCHEK test, and any dogs that were still not protected on the TiterCHEK test, we followed up again at day 13 to 15. At the conclusion of the study, we had saved sera and frozen it at -80 so that we could submit duplicate sera to a reference lab, and in this case it was at Cornell, and they did gold standard testing so that we could compare our Synbiotics TiterCHEK test results against the gold standard testing that was done at Cornell. And Synbiotics labs also received some duplicate samples as well so that they could see what results that they got in their own laboratory conditions. So do any of you use these Synbiotics TiterCHEK or other brands of point-of-care antibody tests in your shelters? Show of hands. Some people do. So Dr. Schultz has done some really wonderful presentations at the Maddie's Institute on antibody testing to save lives, and I would really encourage you to have a look at those presentations at the Maddie's Institute site. It tells you how to use antibody testing so that you can manage your population and save lives in doing so. This is what a Synbiotics TiterCHEK test looks like. It's a number of different wells. The ones here that are red, they're for parvovirus, and the ones in white are for distemper virus. And at either end, these first two wells here at the left and the last two wells at the right, they are control wells. So those are designed to be positive, and we're going to compare our samples with those positive controls. We also had a negative control well, which is the second one from the left there, and this is our data collection sheet there. We made a photographic record of all of our test results so that we could compare the colours. So, our ages, as I said earlier, Port Chicago, they were dogs that had come from Chicago Animal Care and Control. They were 4 to 24 months of age. At Humane Society of Indianapolis, they ended up being 5 months to 12 years of age, these dogs with no known history of vaccination. And when we combined all of those dogs and looked at their test results at the time of enrolment, we found that older dogs tended to have positive test results more frequently than younger dogs, and I suppose that's no surprise to you because you would tend to think that perhaps older dogs have perhaps received vaccination before. We looked at the effect of gender and source, and I'll just take you through this table first. So we have these two columns here are for Poor Chicago, and there were 51 dogs in that group. And these two columns on the right are for Humane Society of Indianapolis. And I have just highlighted in blue any results of particular interest. And you can see here that if these animals were spayed females or neutered males, for parvovirus at both sites, there was 100% protection from the dogs that we sampled. For distemper virus, there was 80% protection in the neutered males from Poor Chicago, but otherwise there was 100% protection at Humane Society of Indianapolis. So if you're taking dogs into a shelter that are already spayed or neutered, from this population, you'd think that there was a higher chance that they may already be protected against distemper and parvovirus, perhaps. Owner relinquished and or transferred animals as well, compared to strays on this second last row. You can see there was a large number at Humane Society of Indianapolis where we had a wide age range there, and also sometimes owners that had been on a waiting list to get their dogs in. There was 94.1% of them that were protected against parvovirus. So in the other site at Poor Chicago, there didn't seem to be as much of a difference between stray animals and owner relinquished or transferred animals. And I'll just present a few graphs here now. So there is Poor Chicago are the bars in blue, and Humane Society of Indianapolis are the bars in red. And we're looking at the antibody response to modified live vaccine over the course of our 2-week study. And this is the percentage of the dogs in the study that were protected using this Synbiotics TiterCHEK test. They received a positive TiterCHEK test result for parvovirus. You can see that there were about 2/3 of them protected
at Purdue, Chicago, a few more than that at Humane Society of Indianapolis, and that response to vaccination with modified live vaccine for parvovirus was pretty well done inside 7 days, just confirming what we know from the published literature. Pretty well all of them, except for one, by day 13 to day 15, did have a positive test result. Same kind of graph, this time for distemper virus, and you can see here that the initial protection status for distemper virus was much lower than it was for parvovirus. It was about a third of dogs were protected, whereas it was more like 2/3 of dogs were coming in protected for parvovirus. Also, the response to the vaccination was a bit slower than for parvovirus. There was much more of a gentle gradient there, and they were pretty well all protected, though, after 2 weeks. So just to discuss the results that we received, more dogs tested positive at intake for parvovirus than for distemper, and we think that there may be perhaps differences in local prevalence of these two different diseases. I know there is a lot of distemper virus down here in the southwest. We don't see very much distemper virus in the Midwest. We see quite a bit of parvovirus. We see a lot more panleukopenia even. So there can be differences in local prevalence of disease. Also, it's just the nature of the way the virus lives in the environment. We all know how difficult parvovirus is to kill in the environment. It stays around a long time. Distemper virus is not as long-lived in the environment, so the environment kills it off naturally itself, whereas parvovirus, dogs can become infected months later if a really good cleanup job hasn't been done. So maybe that is why there were more dogs that already were protected against parvovirus, because they'd had some level of exposure to it earlier. So the older dogs were more likely to be protected, probably because of previous history, and they've just had more time to be exposed to these diseases. Spayed and neutered animals were more likely to be protected, and if they've been spayed and neutered, they're probably more likely to have been vaccinated as well. So that's probably going to explain that finding. We found it interesting that there were similar patterns of protection for stray animals and for owner-relinquished or transferred animals. And I think this partly may be to do with the nature of dogs themselves. Dogs are not big cats. We don't tend to have free-roaming dogs in the community the way we have free-roaming cats in the community. Most dogs like to be with people, and even though they may be stray dogs, it's likely that they were owned by a person, perhaps relatively recently. So if they were owned, then they may have been vaccinated. That may be part of it. Maybe our sample size just wasn't high enough for the statistics to work for us. Maybe we needed to sample 1,000 dogs rather than just 100 dogs. So I'm all for using titer testing as a in-house tool for population management. It's a powerful tool that can really save lives. It can help you establish what are low-risk animals and treat them appropriately, what are higher-risk animals, and treat them appropriately too. As with any study, there were a number of limitations to this study. One of them was they're shelter animals, so the age was estimated. We had a fair idea of the age, but nobody brought a birth certificate with their dog, so it was just estimated on dentition and other things like hair coat, that sort of thing, the same way as you do every day in a shelter. Also, when we had our dogs come into Humane Society of Indianapolis, it was an
inclusion criteria was no known history of vaccination. So perhaps even though no one knew about the history of vaccination doesn't mean that it didn't actually happen. So that could have been a factor that could explain some of our results. We should remember that the way these antibody tests work is that if the dog tests positive for that particular test for parvovirus and distemper, we know that that dog is protected against exposure to those diseases. If the dog tests negative, it could still be protected. We know positive means positive, negative could also mean protected as well. And that's because there's not only antibody-mediated immunity is very important, but also cell-mediated immunity. And the levels of antibodies could decline in concentration over time, but of course there's memory cells that can jolt that dog's immune system into action immediately on any kind of challenge. And that dog's antibody concentration, if it was challenged, that antibody concentration could really jump up within a matter of hours to days. So we've just got to remember that when we're interpreting the test results. There is a natural variability in any shelter population, and any statistician will tell you that to make statistics work, we like a very tight, uniform population. We're not going to get that in a shelter, so that perhaps did provide some statistical limitations for the analysis of our results. So we just wanted to follow up and do a practical study comparing the results that we got using the TiterCHEK test in shelters with people. I'll admit it, I take the prize. The person that was worst at doing this test, that had to do the most do-overs, was me. I always forgot something or whatever. Everybody else seemed to be able to do them quite well, but I had to keep on repeating them. So the shelter results actually include my results as well. And you'll be surprised at how good they seem to be. But we wanted to compare them with the results that we got from Cornell, and also the results that we got under laboratory conditions using that same test kit at Synbiotics. So we wanted to know, can we really get good, accurate results in a shelter situation? We compare colour changes, as you saw with that slide earlier. You compare different shades of blue, and in the test instructions, all you've got to do is compare it with a positive and a negative control well and decide if your test well is positive or negative. In our test, we actually divided the positive and negative control wells into a number of different shades of blue to see whether that enhanced our accuracy at all. So, as I said earlier, we had duplicate and triplicate sera sent to two different places, Cornell and to Synbiotics. We used different shades of blue, and we also used, at Synbiotics Test Lab, they have an optical density reader. So scientists might say to you, well, you're just estimating colour. I want something that is really very objective, not subjective, like a person estimating colour. And an optical density reader will do that for you. It turns particular colours into frequencies and numbers. So I wonder if that really makes a difference to the accuracy of the test reading as well. So, our results. Firstly, this slide is all about the accuracy with canine parvovirus first, and we have sensitivity here in this column and then specificity. We had the regular method, which was just what we did in a shelter situation. Dr. Cinda Crawford also recommended that we could try an extra wash method, that maybe by putting an extra wash step in, that we would enhance the reliability of our results. We had the laboratory performed regular method as well, that was done at Synbiotics with a particular one trained laboratory technician that didn't have a lot of other things going on, and it was the one person doing all of the testing. And there was also an optical density reading as well, so that the machine could tell us what colours that they got. So you can see here that we got excellent results no matter where it was done. The laboratory results didn't seem to be really superior to just even our regular method, and the extra wash didn't seem to really enhance the results appreciably either. For distemper virus, you can see the sensitivity of our distemper virus test was a bit lower than the over 90% that we're getting for all of the other test results. They seem to be able to bump this sensitivity up a little bit in the lab at Synbiotics using their optical density meter and their lab technicians, but we sat around the 75-76% mark for sensitivity, but again around the 90% mark for specificity for distemper virus. So we found that reading the colours as 7 different shades really didn't do anything to enhance the accuracy of the test. And we also found, as I said earlier, that the sensitivity of the distemper virus testing was lower than the other diagnostic parameters for the 2 viruses. But in a way, if you've got to have some parameter that doesn't work as well for you, this is probably a good one to have in a shelter situation, because what we don't want is a lot of false positives where we have animals that we think are protected because of the test results that aren't really protected. If our sensitivity is reduced, what that means is that we're not really going to have a problem with those false positive results. So that's better in a shelter situation. So we can conclude that the in-clinic ELISA testing is a really useful tool. It gives good, accurate results, and it helps us to make population management decisions in shelters. And we could use it in practice to assess the need for parvovirus or distemper vaccination as well in owned animals. And with that, I'd be happy to accept any questions.